Combination of BioRePeel therapy with ARES therapy will allow us to obtain fast, long-lasting results of redermalization of the skin. As the first step of the treatment, we are going to degrease the skin with alcohol. We can use forever therapy to prepare the skin, or we can use alcohol wipe to degrease the skin to remove excess of oils on the skin. BioRePeel FND, it's a biphasic product. That's why it's very important to make sure that two phases are combined very well together. We need to shake the ampule before we draw the product from the bottle. To draw the product, we're using 18 gauge needle, and we draw 2 milliliters of BioRePeel FND. If you leave the syringe on a side, the product might separate. Please pay attention that the product is well mixed in the syringe. You can always shake the syringe before the application to ensure that two phases are combined. Recommended amount of the product, 2 milliliters per face area, 1.5 milliliter neck, 3 to 4 milliliters décolleté. I spread the product evenly onto the treated area. I used 2 milliliters. Now we need to massage the product well to the treated area. We massage the product until it's absorbed by the skin, until your gloves become sticky. After the product is absorbed by the skin, we allow 3 to 5 minutes for the product to penetrate the skin. After 3 to 5 minutes, we remove the product using wet gauze. The product does not need neutralizer. TCA-based product is a self-neutralizing product. The next step of the treatment is going to be the use of ARES AK, dermoreconstructant. Use of this product will allow us to redermalize the skin. This product is going to be used for the skins which need redermalizing, which need refreshing, skins with different lines, rosacea, and different problems such as sensitive skin. We're going to use it in combination with microneedling. I'm using 18G needle, and I'm drawing 2 milliliters of ARES AK from the vial. 2 milliliters per face treatment, 1.5 milliliter per neck treatment, 2 to 3 milliliters per décolleté treatment. So first I'm going to microneedle the skin. Microneedling is superficial. I'm just looking for erythema. You can microneedle slightly deeper where you see lines and wrinkles. Microneedling is nothing else but collagen induction therapy. It will also help increase the absorption by the active ingredients up to 80%. Under the eyes, we're using 0.25 millimeters depth. You can use stamp method if you're working slightly deeper. For skin with visible signs of aging, we're microneedling to the pinpoint bleeding points, which means that you will be able to see slight drops of blood. But as you can see, the treatment is not invasive and the patient is going to be able to come back to the daily duties immediately after the treatment. I see some open pores, and in those areas where the pores are more visible, I'm microneedling to the pinpoint bleeding points. After the first passage of microneedling, I am applying ARES AK. As you can see, this is very rich, thick mesogel. And we're doing second passage of microneedling. Depending on the skin needs, you may choose from 3 different types of ARES line: ARES antioxidant, ARES anti-aging with different biomimetic peptides, or ARES AK derma reconstructed. We always use 2 milliliters per face treatment, 1.5 per neck, 2 to 3 milliliters per décolleté area. Depth of microneedling should always be adjusted to the need of patient's skin. As you can see, I'm microneedling slightly deeper where I can see lines and wrinkles. It will allow for faster collagen proliferation. We allow 2 to 3 minutes for the product absorption. As we can see, the product was absorbed very quickly by the skin. To complete the therapy, I'm going to use BioReHydra and BioReLift. These 2 products will ensure that we're not going to see any complications post the therapy, as they are compatible with both BioRePeel and ARES therapy. They will also allow for the longer effects, for the prolonged effects of the BioRePeel and ARES therapy. Those 2 products are going to be used by your patients at home during the whole length of the therapy. I will apply a small amount of the BioReHydra to the treated area. BioReHydra could be used after all aesthetic medicine procedures, post-lasers, post-RF, or any other invasive procedures. As you can see, the product is a very light serum, very fast absorbing by the skin. Then I'm using BioReLift. BioReLift will allow the skin barrier to rebuild very quickly to ensure long-lasting effects of the therapy. It's a very rich but fast absorbing formula. And as the last step, I'm going to use SPF. Use of SPF is recommended throughout the whole treatment of BioRePeel and ARES therapy.